The novel coronavirus has been sweeping across the globe, leaving deaths, new safety protocols, and economic crashes in its wake. But nowhere else has had such a drastic impact like the health industry, with hospitals in every hemisphere being overwhelmed by the surging cases, and the frontline workers, doctors, and nurses being faced with saving lives while theirs are also at risk. Here at the Barbados Community College, students in the bachelor degree program spent their lockdown on the front lines of the crisis, while volunteering at the Queen Elizabeth Hospital, among other healthcare facilities. We talked to some of them to see what their experience was like.
For me personally, it wasn't much different than a normal day at clinicals or work, whatever you choose to call it. The only difference was, wearing the mask but other than that, it really wasn't much of a difference because you normally have to wash your hands as much as we did during COVID. You normally have to carry out all the same health precautions that we did during COVID. So really and truthfully for me, it really was just another day at work.
Well, at first, before they sent out an email asking for help at the Queen Elizabeth Hospital, I was a little bit fearful, but I told myself that being in the field that I am in, nursing, that there may be another pandemic that may come and I may have to battle through that. So I just went out and see how the experience was with assisting nurses at the Queen Elizabeth Hospital during the COVID times. I basically followed the protocol, made sure that I got the equipment that I needed to do the job that I had to do, and I did it to the best of my ability.
Prepared to go into the medical profession is difficult enough, but going into a pandemic is something that no one could be prepared for, as the number of confirmed cases worldwide surged to over 32 million, and with the vaccine not expected to be available wide scale until 2021. How are nursing students being prepared to enter into a world where viruses like COVID-19 can take thousands of lives quickly? We sat down with the head of Student Nurses Association, Tracy Collins, to find out.
I can tell you, as a student nurse, we do not get stipend, and that's one of the biggest things financially that was a factor, because obviously you're giving of your time, because the program, as you could appreciate, is 4 years of your time to obtain this degree. So for me, there was some fears of the fact of how I would be able to manage going to volunteer somewhat what we would just consider as clinicals, knowing the fact that you probably might have someone at home with a immune compromised system, and the risk of it all is that you're going to a hospital. There are many bacteria and viruses out there, and now COVID. So it was a risk too of you contracting COVID. But that didn't deter me from going and volunteering, because I believe that if there is a need and this is the profession that I chose, and why would I stay at home during a time when I am really needed? Mental health, being an executive comes with many different challenges. But although I wouldn't have had the resources needed, I honestly always just used to tell myself, you know what is to be will be. And I will always try my best. I try to network and reach my voice where it can be heard. So I try not to be stressed too much, but coming into the end, at first, I didn't really believe that COVID would get to Barbados so quickly. I did several courses online about COVID and handling of COVID patients and so on, because it's best to be knowledgeable in the fact instead of running away from what is actually facing you. In terms of counseling, yes, I believe there should be counseling more so readily available for the student nurses at this time, even prior to actually going back into the clinical area. But as you could appreciate, yes, there are counseling services available on college, but obviously you have to make an appointment. And based on the fact, it has to be working hours, and, the flexibility of the students, it varies because each student has a clinical rotation to attend to. they may not be able to get to the college for when the appointment is. So I think there should at least be a telephone hotline available that can be always readily available for not only nursing students, but all students of college, because this is a very ticklish time where you're going into the unknown. You're really trying to put certain protocols and so on in place.
Many nurses are expected to put on a brave face when dealing with patients, especially now when they're a lot more aware of the effects and ways that COVID can be spread. Nurses are not just frontline workers, they are humans too, and require just as much mental support as we do. Therefore, as people, we need to make sure that we take care of those who take care of us.